Hi everyone, Jim Gonzalez here. It's another Wednesday, and we're going to go over talking about what the role of an EDI clearinghouse is in streamlining healthcare claims. So a lot of times, individual companies. So let's take a step back. So healthcare claims. What does that consist of? Well, that can consist of hospitals, local doctors' offices, chiropractors, psychiatrists, all those encompassed healthcare service organizations all have to process payments, requests for payments, eligibility, claims, all of those different type of documents that interweave throughout those different companies get sent to an insurance provider. Sometimes that insurance provider could be the largest one in the world, um, at least for us, anyways, in the world of EDI. The government, so CMS. So think of Medicare, Medicaid. Also think of the other providers that are out there that are Blue Cross, Blue Shield, Cigna, United Healthcare. The name goes on and on and on and on and on and on. So in the world of EDI, when it comes to these smaller offices or grouping of offices or any of those type of things, a lot of them don't have EDI capabilities. So they don't have a platform that they can enter in their claims, send it off, do those type of things to create the EDI that is necessary. So what they do is they rely on these, what we consider clearinghouses, EDI clearinghouses, and they'll allow them to upload, an Excel spreadsheet. They'll allow them sometimes to go into a portal and enter the claims or look at eligibility or whatever it may be involved in the healthcare document process that they're needing to do. But they're going to charge on a basis of how they're utilizing the system, whether it be how many claims. And I look through majority of the ones that are out there that are well known. And the ones that are out there, they'll, on a typical, just to give the audience an understanding, they'll have a monthly basis where they'll charge as small as, $0, or they'll go from $25 up to $2,000 per month, depending on how many claims you're doing. And then some of them, now they put you in a bucket. They'll say, okay, for this amount per month, you can do 500 claims. For this amount per month, you can do 1,000 claims, whatever. So it's basically a tiered or growing scale. And then they'll have overages on top of it. So overages can range from 9 cents. I've seen as all the way up as high as 85 cents. And the reason I'm sharing that is so that it gives you an understanding that even as a small organization and you're dealing with EDI claims, so you're just a dentist facility and it's a one chair facility and you're doing claims, how many people, patients, do you think that dentist can see in a day's time, in a week's time, in a month's time? So you take all those visits and you figure out based on those visits is how many claims that one dentist is processing in a month. So that number can grow pretty quick. So if you're seeing one person per hour, 8 hours in a day, 5 days a week, easy numbers, you're doing 40 claims per week. Then you go per month. So 40 claims, we'll just say times 4. Now you're looking at 160 claims. So it starts to give you an understanding as to how these clearinghouses can actually start making some substantial money on these small facilities, larger facilities, all of the such that are essentially the EDI clearinghouse is allowing you to upload and it'll convert it into an EDI document. You can look at notifications, you can do all these bells and whistles and everything else with it, but there's a price that goes along with it. There's also what they're doing. So they're establishing connections. One of the largest one out there, Avality, has, as they say on their site, a few thousand connections to insurance companies that they deal with. So they've gone along and they've made these connections. So they've said, hey, Cigna, I would like to set up an EDI connection to you, and I'm going to be an EDI clearinghouse, as it's called in healthcare. Instead of that, we think in retail, EDI managed services. It's really what they're doing. So they're managing that connection to Cigna for multiple people. No, they do that repetitively. They get them all set up. They're all ready to go. And now, if you want to deal with those thousands of insurance providers, instead of you having to set up all those connections and you having to set up EDI, you go through them. But again, that monthly cost can be quite substantial, even as a small group or a small office of healthcare providers, because it depends on your claim volume, what you're spending, all those things. I've run across organizations that weren't really what we consider large, but they were doing like 10,000 claims a month, and they were spending hundreds of dollars per month for those claims. And then when I broke it down and I said, hey, listen, this is going to cost you X to set up direct to these payers using an EDI platform, and I can drop your monthly costs down to this. Now, your initial, you have a fee, you get that set up. Once it's set up, that's a one-time investment. It's all taken care of. And then your monthly fee is a lot smaller than what you were paying, almost quarter. Think about that. So now I've just dropped it. I've given you what's called a return on investment, all of those fun things. So EDI Clearinghouse is to make your life easier, but it's also going to be expensive. Or you can bring it in-house, go direct to those insurance providers, get up and running with them, because most offices, in all fairness, they deal with 10 or less insurance providers. So really, yeah, they're showing you, oh yeah, we're connected to thousands, but you'll never do thousands. So understand, a clearinghouse is showing you the big, shiny. Now, the other problem is a lot of the clearinghouses that are out there that we've run across, they have poor customer service. You reach out, you ask questions, you get a portal response or an email response, or you'll be lucky to get somebody on the phone to actually talk to you and go through those different things. Now, I'm not saying they're all bad. I'm just saying there's some that are out there that really are not going to help you. They're just essentially going to take your money and they're just going to move forward, and you have to deal with it. We just set up one recently for a client, and they're doing tens of thousands of documents, claims per month. And the clearinghouse that we're dealing with we were reaching out to them to set up for EDI processing to make the lives easier. They have a back end, the client has a back end system that we're pulling it out, which happens to be Salesforce. So we're pulling it out of Salesforce. We're processing it over to Avality, which happens to be one of the largest, if not the largest, clearinghouse that's offered, at least that we see here in the United States. From a retail standpoint, think of an SPS Commerce. I put them on the same level. When we reached out and we were talking to the Avality folks in customer service, we're not talking on the phone. Well, we did have some conversations over the phone. They were really limited in resources or helping us while we were establishing that EDI connection. And you're talking about people that do this day in and day out. That's a recent experience within this year, a couple months. So understand that some of them, even if you're very technical, they're going to be limited in how much they help you with establishing an EDI connection direct to them for automating the process. I always feel, if you can, remove that middle clearinghouse, go direct to the insurance providers, because again, you're only dealing with a certain amount. Now, if you're dealing with the whole state Well, guess what? There could be numerous. If you're an office facility and you have 5, it might be cheaper and easier. And yeah, upfront, it's probably going to cost you more, but in the long run, it's going to end up being cheaper. So one of the questions that we have here while I was talking about that is mapping documents process. Not exactly sure what you mean by KD. What I'm referring to and what I'm talking about is the different healthcare EDI clearinghouses. Those clearinghouses do most of the mapping documents. So from an Excel spreadsheet to an actual EDI claim document, they're actually doing that for you. That's where a clearinghouse comes into play. You're essentially just needing to either use their portal or you can do an upload and you can obtain that information. Now, if you're getting into actual mapping that I'm saying about removing and eliminating the clearinghouse and going direct to the provider, yes. Or where I'm saying, hey, if you're dealing with a whole state, because maybe you deal with a program or have funding or any of those type of things, and it's just a lot easier because you don't just deal with 5, maybe you deal with hundreds, and it still makes sense financially. Now it makes a little bit more sense to use a clearinghouse, because as that funding grows and as you add more and more people that can actually obtain your services, your insurance providers grow. So if you don't have somebody on staff or you don't want to do all of those direct connections, because that can get expensive, then a clearinghouse might make sense. But if you're going to establish that EDI direction through a clearinghouse, guess what? You're going to have to look at the costs. Like I said, the numbers that I was giving here, the one had $2,000 a month, but that was only 10,000 transactions. And then it had an overage at 9 cents. Well, think about that. If you're dealing with a statewide program that you help to facilitate, and it's getting paid by the government or it's getting paid by all these different providers, fractional off of cost, it could get quite expensive if you do direct. And it could get very hard to do if you're doing direct. As far as the documents go, when we're sitting here and we're talking about EDI healthcare, I have to, just as educational, so that people understand what we're looking at and what we're dealing with in the EDI healthcare space. When I'm talking about the documents and the document flow and the mapping of documents, we're talking about like a 270, which is your eligibility requests. You have a 271, which provides you the results of what they found. You also have where you're dealing with basically a 278, 270. So 278 is, let me go through this list. 270 eligibility requests. So checking if somebody's eligible for handling and understanding what all it's dealing with. So think of it as almost like an 810. You have, along with that, you're dealing with your 271, which is the results of that. You have a 276, which is a claim status. You have a 277, which is a claim acknowledgement. You have a 278, which is prior authorization. So if you understand what they're doing in an office and what they're doing at a health facility, you have to, again, think of it from a personal standpoint. You have to make sure, A, are you allowed to have that procedure done? So we got to get authorization, or we got to check into the eligibility. Okay. So you have EDI documents that are being exchanged to do that. You also have your claim. You also have what's the status of your claim. You have, did they acknowledge our claim? Hey, we want to get paid, 835. So electronic payment remits. 837, which is a response to a account adjustment. And then you have a functional acknowledgement, a 999. So those are the typical documents that you're running across in the healthcare space. And there could be other ones that are added into that. But when you're looking at healthcare in a whole, you have to look at yourselves as individuals. Are you a doctor's office? Are you a hospital? Are you an outside facilitator of a certain funded project? What are you? And then it might make sense to use a clearinghouse or not use a clearinghouse, depending on how many providers you're looking to hook up with. You know, those insurance providers that are paying your facility or facilities, it could be easier and cheaper in the long run, return on investment, to go direct or to utilize a clearinghouse. And it gets into even further, does the insurance provider, are they on that payer list of the clearinghouse? So an EDI clearinghouse is a facilitator of moving those documents electronically amongst an insurance payer and a healthcare organization, provider, facilitator. They link them together. Typically, like I said, you can use a portal on those EDI clearinghouses, you can upload, and you can exchange with them API or EDI, some method of electronic exchange. I'm hoping this video gives you an explanation as to what those EDI clearance houses are. All right, so here we go. Let's look at this comment. I'm in a different insurance industry, but I'm thankful for the clearinghouses so that I don't have to set up and monitor as many partners and processes, but the middlemen can become cumbersome when there are data issues for sure. I agree, Renee. And that's why I always tell people you have to look at who you are, who's your organization or who's your client that you're helping, and ask them those questions. Because just because it works for somebody else, it may not work for you, or it may not be the particular answer for you. From a technical standpoint, from a cost standpoint, from all of those different things, you have to realize that. And an EDI clearinghouse is the same way. They facilitate, they've already established all those connections. They're just reusing those connections over and over and selling them to you and making money, whether it be at an exorbitant rate, a lowered rate, any of those type of things. Can we help you get set up, linked to clearinghouses to process EDI? Yes. Can we help you to get set up with direct provider? Yes. Can we do those so that you can exchange data back and forth? Yes. Can I do that on a cloud model or on an on-prem model? Yes. So you have options. You have things that are out there that are enabling you, that allow you to do these type of things. You just have to figure out which one makes sense for you. And if you don't know how to figure that out, reach out to an organization like EDI Support LLC, and we'll help you to determine it. We'll answer these questions. We'll be the devil's advocate and figure it out and get you taken care of. So with all that being said, that's the beauty of doing this on a weekly basis. We get to sit here and figure out how things are going, how things are working for individuals, and really help you to answer those questions. And if we can't help you directly, we know somebody that can. I try to pride myself in knowing a lot of information, a lot of things that are out there in the API, EDI, and integration world, or as I say it, moving data. But there's some stuff I don't know. I don't know everything, believe me. But I have a lot of resources that I can figure it out, and I can find the answers if I don't know them or my team doesn't know them. So as I always say, follow us here on LinkedIn, subscribe to our channel on YouTube, join our Discord group to keep learning from the experts and have quick answers to your EDI and API questions. All of those links are in the details section of this event. And again, it's another great Wednesday. We're getting closer to the end of the year. Holiday season's coming upon us, and it's getting a little chilly here in Pennsylvania. But look forward to talking to everybody again next Wednesday. We'll figure out what's the next topic. And I am working on getting some people so that we can get other people interacting with me, and you don't just get to see me and talk with me or listen to me. So send your comments, give me feedback, thumbs up, whatever you want. I love to hear pros, cons, you name it. It just helps me. It helps me to grow. It's also going to help everybody that's out there that watches this stuff to grow. Take care, everybody.